At 6:30, Sports Day will have the latest sports news. Then at 7, The View from Washington in Beyond 100 Days.
President Trump warns Iran there will be severe consequences if it restarts its... The cancer specialist who's been told to leave the UK as doctors warn the lives of some patients are being put at risk by tighter immigration rules. Good evening and welcome to the BBC News at 6. The lives of some cancer patients are being put at risk because of immigration rules. That's according to specialist doctors. They have told the BBC that the NHS is struggling to recruit health professionals who can identify people at risk of hereditary cancer and other serious conditions. They say workers from abroad are now having problems getting visas because the immigration rules have tightened. Our health editor Hugh Pym reports.
She had an NHS job in a role with growing importance in cancer prevention, but Steph was not allowed to stay in the UK. She was refused a visa and has had to go back home to New Zealand. Before she left, she told me how she felt when she got news that her visa would not be updated.
It was really disappointing to get confirmation. I really enjoy working here and I really enjoy my job and would like to continue doing it, but unfortunately I can't without a visa.
Steph is a genetic counsellor. This involves identifying patients who might be at risk of developing hereditary cancers and other diseases and then discussing their options, including preemptive surgery. This leading breast cancer surgeon explained why the work of a genetic counsellor is so important.
NHS should have enough number of clinical genetics teams, because if we don't, then there will be women who are at risk, who could potentially be prevented from getting cancer, end up developing cancer and unnecessarily going through major treatment and possibly worse outcome.
Genetic medicine experts say there is a workforce shortage and visa rules are making things worse. There's a migrant cap on the number of workers in the UK allowed to come in from outside the EU. Nurses and some doctors are given priority on a shortage occupation list. But many other health professionals, including genetic counsellors, are not on the list and more likely to be turned down. The Home Office said the list was set following advice from the Independent Migration Advisory Committee and kept under regular review. Doctors in the field say patient care is being compromised because of recruitment problems.
The fact that we are unable to run safe cancer genetic services in this country, I think it is awful. Unequivocally, waits are getting longer. It varies depending on hospital trust and where you are in the UK, but we are aware now of at least one trust that is about to have 3 empty positions.
Steph's employer is holding her job open in case she's successful with another visa application, but it may well be that her skills are lost to the NHS. Hugh Pym, BBC News.